Hello, and welcome to the Mind series. My name is Susan Diax Kearns, and I'm a licensed marriage and family therapist and clinical director at Mind Matters Clinic in Murphys. And I'm here today with Dr. Ryan Thompson, and we're going to be talking about nutrition and lifestyle as it relates with attention deficit hyperactivity disorder. So we'll give you a little background a bit about ADHD, or attention deficit hyperactivity disorder. What is the background of? I'll let Dr. Thompson tell you that.
Well, ADHD, or ADD, which means attention deficit disorder without the hyperactivity, so with or without, it affects about 9% of the childhood population currently in the United States. So it's a very common disorder if you're talking about almost 1 out of 10 kids that we're going to see. And so it's an area that has a lot of interest as far as looking for interventions that may be effective for those kids because it is so common. So that's what we're going to explore tonight.
So one of the things that I think of as a marriage and family therapist who has a child coming in who's inattentive, can't pay attention, wiggling, moves around, can't focus, that kind of thing. The first thing that often comes to mind, a question that's often asked me by parents, is how does diet affect it, particularly sugar? You know, for some children, I've always heard that if you eat a lot of sugar, you're going to get hyperactive. So can sugar cause ADHD?
Well, most studies actually have been really inconclusive as far as that, because as far back as I go in residency, that used to be something that was talked about a lot, that we would always hear about, give my kid my sugar, that he gets more hyperactive. But really, studies have not been really very supportive of that. There's been some that show that there may be an effect in some kids. And in the end, what it seems like is that sugar given without any other kind of nutrition, meaning fiber or protein or anything like that, may increase their symptoms. It certainly doesn't cause ADHD. And oftentimes the other thing you hear about is that the child being given sugar, like they get a Pepsi and cake and that sort of thing, but they're at a birthday party. Mm-hmm. So then was it the cake, was it the sugar, or was it the situation they're in that made them seem more hyperactive? So sugar is something certainly that should be limited on many reasons, many health reasons. You know, and ADHD may be one of them, but certainly obesity and lots of other reasons not to give it. But it's not a big factor in ADHD.
So when you talk to families or parents and you're talking to them about nutrition, do you say absolutely no sugar?
No, I don't. And usually when I'm coaching them back about or really what is appropriate nutrition for a child with ADHD, and that sugar is something that I say on a case-to-case basis. If you find that it seems to aggravate your child's symptoms, then it certainly is worthwhile to limit that or to make sure it's given in combination with other foods. But it really is kind of a use your judgment if you think it's there, but I really can't say I can embrace it entirely and say that I think that's a big factor. I think if anything, it's probably a modest factor.
Okay. The other thing that I've heard via the, you know, there's a lot of different people out there with opinions about ADHD, from the idea that ADHD is not really an illness to the idea that it's a big illness and the only way to treat it is medicine. And so one of the things that I've heard is that if you start in the morning with a protein breakfast, that can actually help manage the symptoms of ADHD. What do you think?
Well, you asked two questions. One, is ADHD real or not? And obviously it's been pretty well proven that it is real, that there is a genetic basis to it. There's also an environmental basis to it. And so you have a genetic piece and you have an environmental piece, which means something that happens in your life, in your environment, in your diet, in the atmosphere, mm-hmm. things that can affect right. how much it exists or if whether or not it exists at all, perhaps. Certainly diet's a big part of that. And one of the things that's actually has been shown pretty well in many studies is that a high-protein breakfast does help a kid in school and does help them with focus and attention during the day. And a high-protein breakfast does not mean that you cannot eat anything but protein, but you have to eat more protein relative to carbohydrate. Carbohydrates being starches and sugars and things like that. So for example, if a child eats a piece of toast, which would be mostly carbohydrate, a little bit of protein if it's whole grain, but would you then match that with more protein relative to the carbohydrate, which be peanut butter or put cheese on it or any kind of nuts or meat or something like that, then you would allow for more carbohydrate that way. An example of what you wouldn't want to give a child would be something like waffles or pancakes smothered in syrup and a glass of orange juice, because then that would be basically all carbohydrate. And the two ways that protein works in that situation, one is it stabilizes delivery of sugar to the brain to where it comes in a nice smooth fashion rather than in kind of a burst. When you eat a waffle, it's going to rush to your brain, basically a sugar rush. It then drops off very quickly. The other thing that protein does is it changes the way that the brain chemicals communicate with one another. So it has a direct influence on the effectiveness of brain communication. So that's why protein is important, especially in the morning, because it can carry you through the day. So high protein breakfast really is something that I usually recommend early on in the course of treating parents with, or treating kids as far as when they have ADHD.
Okay. The other thing that's been talked about that I know that you do, and that it comes out in the newspaper and on TV all the time, is about the importance currently of like omega-3s, fish oil, that kind of thing. You hear it a lot lately that they're using it for anything really related to the brain. Do you use it with, well, I know you use it. How do you use it with kids?
And why?
And why?
Okay. There's fatty acids are a type of a fat, basically, that you get through the diet, and they can be changed a little bit once they're in your system, but they're an essential part of the brain function in two different ways. Omega-3 fatty acids are the most important ones when it comes to brain function. And omega-3, the 3 means where is it located on the molecule. You can have omega-3, 6, or 9. That's where the bond is. So omega-3 is the one that's most important in brain function. And what they found in a lot of studies with kids with ADHD is that for reasons which aren't entirely clear, they tend to have low serum level, low blood levels of the omega-3 fatty acids compared to kids who don't have ADHD. And when you give them omega-3, oftentimes they improve in their function as in the classroom with focus, attention, hyperactivity, all the things you see in ADHD. The best ways of getting it are either eating foods that have a lot of omega-3 fatty acids, things like walnuts and avocados and fish, but I don't know how much fish kids will typically eat. Mm-hmm. So oftentimes you end up supplementing a kid with an omega-3 fatty acid supplement. It helps both in the development of the brain. 20% of the child's brain is made up. The membranes in the brain are made up of omega-3 fatty acids. And also it works as an antioxidant in the brain, which helps the brain function. So it has two different functions, and both of which can show both short-term and long-term effect if you supplement their diet.
So I'm going to ask you a couple more things about diet, but a question arises as you're talking. It's fascinating, isn't it? Because what you're talking about essentially is limit sugar. Well, I don't know if this is what you're saying. So what I'm hearing is limit sugar, bring protein into the diet, particularly in the morning, bring some omega-3s, whether it's supplement or increase it, and it can really help support a child who has ADHD to focus and pay attention better. And so my question comes to, why not just alter their nutrition?
Well, actually, for some kids, that's effective. I mean, it kind of depends on my experience is that if a child is not severely affected with ADHD, I mean, if they have relatively mild symptoms, sometimes these things all by themselves are the only thing they'll need. And I certainly have kids who respond well enough to these kind of interventions that they don't require anything else. And that's wonderful when it happens. It's not a guarantee, though. There's certainly no guarantee that any one intervention, any one treatment's going to work the best. But certainly these things are relatively easy to do. They're certainly healthy. And so if you try these things initially and they have benefit, even if it's a partial benefit, then any further intervention requires less benefit because you've already achieved 20% or 30% benefit with these interventions. And yeah, I see a fair number of kids who do well with it. It's just whether or not it's well enough to become successful in what they want to do.
And would you try that first? Like, would you try things like diet, altering the diet before you were to, say, put a child on some kind of medicine? Usually.
I mean, and again, it depends partly when I see the patient. If I see the patient and they're in crisis, sometimes it's hard to wait. Because like with omega-3 fatty acids, it takes 4 to 8 weeks to see a benefit. Okay. The high protein breakfast, sometimes it depends on the child. Sometimes they'll refuse to eat breakfast. Sometimes they'll refuse to eat the protein that the parent offers. Sometimes the parents have trouble being consistent as far as offering the protein. So sometimes those things, interventions, even in the best of hands, are hard to implement. And then how much of a rush are we to see benefit? And sometimes you get kind of pushed if they're in a crisis. But certainly if you have the time to do it, and you have parents who are committed and capable, and a child perhaps is willing, then that's kind of the best scenario, is if everybody's able to do that, and then you try to do that first.
So tell me now about food dyes. So I've heard you talk about food dyes, and the tricky part for me, the thing I always like to hear you talk about, is not only the impact on the system, but also where to find food dyes. Because, I think of it as in, red candy. Mm-hmm. But I've heard you say things like it's in cheese.
Right. Food dyes, they've done some pretty good studies just recently, even in the United Kingdom, where they found between 15 and 20% of kids who have ADHD show negative effects when they consume food dyes. And it's the amount of food dye that they eat that shows how much negative effect it is. So a large amount of food dye eaten will cause a large effect as far as ADHD in a negative way, causing more symptoms. So by the same token, if they're currently eating a lot of food dyes and you substantially restrict that, then oftentimes their symptoms go down proportional to the amount of food dye you've taken away. Food dyes are not a food allergy, which we might mention later, meaning that you're not allergic to the food, but the chemical in the food dye appears to interfere with brain chemical transmission. So it interferes with the function of the brain, but it's not an allergy. And so it is something it's kind of like a dose. If I gave them 2 grams of a food dye, and it can be any food dye. It's not just red. Red is the one everybody seems to zero in on. Oh yeah, it was the red one.
Right.
Perhaps because red is the most obvious. Mm-hmm. But it can be yellow and blue and different things like that. It's not just that kind of food dye. But there are a lot of hidden food dyes. Like you mentioned, cheese. Is cheddar cheese naturally orange?
Right.
I had never really even considered the notion that it was anything but orange. Mm-hmm. Of course, it's orange when you think about it. Not too many cow products turn orange left unattended. So how many times do you see orange cheddar cheese without a food dye? Of course it has food dye in it. Mm-hmm. And they do have white cheddar cheese.
Yep.
I used to think white cheddar cheese was somehow they must have taken something out to keep it from being orange, but that's not that. A lot of other things like drinks, fruit drinks, some of them you think would be, like V8 Splash has a lot of food dye in it. It sounds healthy, but if you read the label, there's no food dye hiding in food that is not on the label. So it's not like you're going to find a mystery food dye unless you don't look at the label. Mm-hmm. Tostitos corn chips, which seem like they'd be just white corn chips, mm-hmm. Why would they have food dye in them? They don't look orange or you got red, yet they have food dye in them. So sometimes it is you have to do kind of the hunt and search thing. And if you try a food dye-free diet for a period of 2 to 4 weeks and you're pretty good about it, and you see benefit, then it's worth pursuing. If you go 2 to 4 weeks and you don't see any change, it's probably not what's affecting your child in this regard.
Right. I had a child come in my office, and the mom found food dyes in ice cream. Mm-hmm. And like a brand of ice cream that I would think would be a healthy brand of ice cream, not just a inexpensive.
And it wasn't named bubble gum or something like that.
No, chocolate.
Right.
I think, just the importance of reading labels seems.
And I know I told you this story before where I had a child that I was seeing for ADD, and we took her off food dyes, and basically her symptoms vanished. And I no longer see her, and she's excelled in school, and the problem went away. Mm-hmm. I mean, that's an extreme example, but if it's your child and you try that and that's the result, wow, it's a powerful thing to try.
Yeah. The other thing I'm going to skip down to is organic food. Mm-hmm. And what do you see? What do you see as the benefits? There's a lot of stories going on about pesticides and its impact on a lot of different things.
Well, they've had 2 studies now showing effects of pesticides in development of ADHD. It's hard because I know that organic foods are more costly, but I also know now, kind of beyond a shadow of doubt, that it is definitely a risk factor for development of ADHD. Oh. And the specific type is called organophosphates. And they've done 2 different studies, one with a group of kids and their level of exposure to pesticides, and another one where they had level of exposure in the urine, basically, so they know how much they've been exposed to indirectly. And both of those showed a substantial increase in the risk of ADHD. Now, that would be an environmental factor, not necessarily genetic. Could be partially genetic and partially pesticide, we don't know. But knowing that, if I have a child now and I'm raising the child and I want to reduce their risk of developing ADHD in our world, which we know is increasing, then organic foods, particularly fruits and vegetables that we know are high in those residues, they have something called the dirty dozen, which is the 12 fruits and vegetables which are known to have the highest levels of residues, strawberries being one, celery being another, things like that that seem healthy.
Yeah.
You know, I love strawberries, but when you read that one, you gotta go, well, that one's a hard one to say I want to give that to my kid anymore. So, so you can look up the ones that are at least relatively safe, or buy all organic if you can afford it. But I think that's a reasonable thing to recommend to parents now.
So these things, they impact the symptoms of ADHD, or actually the...
What they believe with organophosphates is it actually causes ADHD. But there's not, unfortunately, there's no proof, because we don't have a way to prove that the pesticide altered the brain function permanently. And what we don't know is if you took away the pesticides out of the diet, will that then
Right, that was my
reverse
question.
it? We don't know that yet.
Don't know that yet, okay.
This study, one of those studies just came out last month, so this is just now being discovered.
Okay. And so then I'll go back to allergies. And if you could tell us a little bit about allergies. How do kids, how does it impact?
There are many kids who have food allergy. Food allergy means you have a sensitivity to a food. Occasionally it's actually what's called an antibody, which is a protein produced by the body against that food. So it wants to attack that food. And so some kids with ADHD have food allergies, and that causes basically the ADHD symptoms. And again, there's a question of is it causing it, or does somebody have a genetic predisposition to have ADHD, and having the food allergy then kind of activates the ADHD symptoms. But what they found is that there are many kids who have food sensitivities or food allergies when exposed to those foods in proper amounts, or sometimes even very small amounts, will have an increase in their ADHD symptoms. And then withdrawing those foods, you'll see that their symptoms improve. It is typically a relatively small number of foods that cause it. Unfortunately, they're relatively common foods. So things like wheat, eggs, milk, corn, soy, berries, peanuts, things like that, those are kind of the ones that are most typical. And so if there's any hint of food sensitivity otherwise, like they have eczema or rash kind of a thing, or asthma, other evidence of a food intolerance, then that is a very worthwhile, again, thing to try. Try eliminating 2 of those foods at any one time and seeing if symptoms go away, and if they do, then pursue not giving that food and see if it happens. If you're not sure after a month of doing something like that, you can always re-challenge them, which means you give them back the food and see if the ADHD symptoms recur. They've done blood testing and urine testing and skin testing in the past. They're not really good at predicting it. They're not really good at proving or disproving whether or not the child would respond. So the only really good way right now is to eliminate those foods and see what happens.
One of the things that I notice with parents, really quickly around that, is that people are so desperate for an answer that it's really helpful for me to manage parents through it, in the sense that some parents take everything out of the diet in the hopes that this is going to be the answer. And then the kid, is eating
nothing.
Cardboard. And so just helping parents to have a balance seems important.
Yes,
important to
and it's hard because you're desperate as a parent to try to make things happen.
Yes.
And sometimes you take on doing too many things at once.
Right.
And if something does change, you don't know what you did.
Exactly.
Right.
You've eliminated this and that, and you've added this oil and So in addition to nutrition, we're also talking about sort of lifestyle, again, along the lines of environmental factors and the impact and whatnot. And so I hear you talk a lot about, and I have my own personal bias about television and the impact on the symptoms.
Well, one of the questions, just epidemiology, why is it increasing in our nation? And one of the things you would wonder about in our last 50 years is the advent of electronics, and they've done some studies which have been pretty critical of the development of ADHD in kids who do television, and I'll go ahead and just throw video gaming in it because it's basically electronics.
Yes.
And kids who watch television prior to age 2 have an increased risk of ADHD. Those who, and the American Academy of Pediatrics recommends no TV prior to age 2. They also notice that kids who watch more electronics or doing video gaming, that sort of thing, have up to a 7-fold increase in risk of developing ADHD or aggravating their symptoms, meaning if they have ADHD, it gets worse. And it really kind of makes sense if you study the way we have trouble paying attention. If you have trouble paying attention, shifting from this thing to this thing to selectively, I want to pay attention over here, now I'm going to drift over here and I'm going to pay attention to that. When you're doing something that's electronic like that, it basically demands your attention. You have no choice but to pay attention to television or video gaming. And that, you can see that when you walk through a living room and try to get your kids' attention. You know,
Right.
It's really hard for them to pull away from the electronic. And basically you're starting to train the brain to pay attention only to those things that kind of force themselves on you. And so electronics really can be potentially harmful to the brain, especially in kids with ADHD. And the hard part about that is parents who have children with ADHD oftentimes find that that is one of the places they can put their kid and they'll be quiet, less hyperactive, and not create trouble. And so it's kind of a mixed bag. I mean, it's nice to have them have something to be quiet doing, yet you can't do too much of it without causing a problem. So it's hard. It's a hard thing.
So do you ask folks to limit TV and video games or screen time, whatever you...
Yes, I do try to ask them to limit that, and I do think that 2 hours a day maximum is probably a reasonable thing to do.
And I know you've talked about outdoor activity helping, and you can tell a little bit more about that. Do you recommend that? Kind of, okay, turn off the screens and get them outside, or playing in the dirt, or...
And outdoor activity did an interesting study on that. Again, I'm always talking about studies, but they're the ones that give me evidence that what I'm thinking may be true. If a child goes outside and they're in an outdoor environment, what their brain is allowed to do then is, again, to selectively pick what they want to pay attention to. If they go out to a park and there's birds singing and there's the river going by and there's the breeze coming by and somebody in the distance running across, or they see a grasshopper or something like that, those are all things that they can select to pay attention to. They don't demand your attention. A breeze or a grasshopper or something like that doesn't demand your attention. You can select, oh, okay, now something's going on over here. I can ease over here. So it trains your brain to say, okay, in this moment I can pay attention to this, in this moment I can pay attention to that. And you can do that in an outdoor environment, and they have done studies showing that kids who have improved focus and attention immediately after returning from a green space, which is going to be a real valuable thing.
What about exercise, sleep?
Exercise is a very important thing, and everybody knows with kids with ADHD, you want to make them run around and burn off energy, and that must be a good thing. And it's true. They do better after they run around, but it's not because they burned off energy. Exercise actually changes blood flow patterns in the brain. They also increases the release of this chemical factor called BDNF, if you want to know, and it changes connections of the neurons in the brain. So exercise improves focus and attention both by the structure of the brain and the blood flow of the brain. So sometimes when kids get kept in from recess because of their ADHD activity and their misbehavior, so they get disciplined by staying inside, you're actually lessening their ability to pay attention after the recess. So that's one of the things you want to encourage them to go outside, you want to encourage them to exercise. When they come home from school, send them outside to exercise. They do much better in both short and long term in doing that.
And the last thing that I wanted to ask you about was supplements. Are there any other kinds of supplements that you recommend that you see?
There's many supplements that are out there. There's literally thousands of supplements that are on the market, and most of them don't have a proven basis for working for ADHD. Some of them are just basically reformulated vitamins and don't have any specific unique property for treating kids with ADHD. There are a few supplements that have been shown to show benefit, at least in small studies. And so there's some evidence that they may be helpful. And again, it's kind of on an individual basis. Some work better than others. One of the ones I commonly use would be omega-3 fatty acids, which would be fish oil or purified fish oil. or other similar supplements, but mostly it's the fish oil capsules used in an appropriate dose for that child. And again, it's kind of delayed response. The other things, minerals. Many kids with ADHD, some kids with ADHD are low in iron levels, and if you check a blood test to see if they're low in iron level and you supplement them with iron, that you'll see improvement in their function after that. And that one's an easy one to kind of prove before you give the supplement. Zinc and magnesium have been shown in studies in some kids to show benefit. Zinc in particular when used with medication, but also when used alone. And again, kids with ADHD have been found to have relatively low level of those two chemicals in their bloodstream. And lastly, the other thing is, well, two other things. One's called P5, P50, which is an activated B vitamin. That's been shown to be effective. And then pycnogenol, which is from grapeseed extract or from pine bark extract, is an antioxidant that's been found to be beneficial in some kids with ADHD.
So I've always been curious because I see you offering these things to the kids and grown-ups at our clinic. How would those kinds of things impact me? So in the sense of the way you've talked about nutrition, so more protein, limiting food dyes, omega-3.
I mean, for a normal person?
For a neurotypical normal person, relatively speaking.
Well, some of those things I think are unique to ADHD, like low zinc and magnesium and levels, the fatty acid levels typically being low. I don't think they would have much benefit for you for that purpose. Mm-hmm. Sometimes there's other things, but certainly limiting food dyes and eating a high-protein breakfast and things like that can be beneficial to anybody. We all know exercise can help anybody's ability to be alert and pay attention for reasons other than just the change in the brain factors. So yeah, it can be helpful for anybody.
Okay.
Those parts.
Great. Well, anything else that you want to make sure to say before we close?
I guess what I want to make sure to reiterate maybe is that if you choose, anything you choose to do, working with somebody who has a sense of what might work, how long it might take to work, and making sure it's going to, the things that you're using together may be the best plan. And being patient, because we all know anything like ADHD is a long-term effort. It's not a short-term fix. There's not going to be any rapid answers, so making sure you're looking for all the options, do them in stepwise fashion, and just be patient, wait it out.
Great. All right. Well, thank you for joining us for the Mind series. I'll just give a little reminder that we're Mind Matters Clinic. We're in Murphy's. Our phone number is 209-728-2184. I'm Susan. This is Dr. Thompson, and we're both available for questions or comments. And thanks for watching today.